I would now like to introduce our next keynote speaker, Dr. Dharminder Nagar, Managing Director, Paras Health. He is a visionary leader dedicated to creating affordable and quality healthcare across India. He has transformed healthcare delivery in India's smaller towns through innovative solutions. Under his leadership, Paras Healthcare has expanded significantly, bringing accessible and quality medical care to underserved regions across the country. Ladies and gentlemen, please welcome on stage Dr. Dharminder Nagar, Managing Director, Paras Health.
Good morning, everyone. Ladies and gentlemen, healthcare and sustainability, that's the topic. When I thought about this, I had only one thing in mind, that I have a confession to make. Ladies and gentlemen, I have a confession to make. Healthcare is perhaps one of the most polluting industries in the world. That's the confession I make today. The use of single-use plastics in healthcare is growing up exponentially. It is amazing to see how healthcare has grown, accessibility has grown, but wastage has grown exponentially. Dr. Betterjee, you mentioned that your grandfather started the pharmacy chains. Perhaps at that time, tablets were not packaged in 3 layers of plastic, 5 layers of packaging. Before you get to a tablet, you literally have to spend 5 minutes peeling off layers. I have no clue why those 4 layers exist. Absolutely no idea. COVID, the phenomena we saw, was a worldwide healthcare emergency. But ladies and gentlemen, it was an environmental disaster. The amazing amount of plastic that we used, I literally saw it. Amazing amount. And you know the legacy of that? None of our doctors really want to reuse any sort of gowns anymore. They want to use it, throw it away. Use it, throw it away. For a poor country like India, it's a cost burden. It's an environmental burden. Perhaps the Americans can afford to use that much of plastic and get the privilege of lecturing us about environment. It is our duty in healthcare to figure out solutions to reduce our carbon footprint. We are moving forward to an environmental disaster. We recently opened a beautiful hospital in a beautiful part of our country in Kashmir. We are right at the Dal Lake. The amount of plastics we are generating in this small city, it's so hard for us to dispose that hazardous material. There is no single point of disposing it. We've solved for healthcare accessibility in small towns. I've gone to a tier 3 town called Darbhanga in middle of Bihar, but we don't know what to do with our waste. The government doesn't know what to do with our waste. We are still a corporate hospital, we still have resources. Can you imagine a single doctor running a small practice in a nursing home or a small nursing practice? Where does he dispose of? He can't even afford to dispose it off. You'll see at every town entrance in India, huge dumps. Earlier, these dumps used to be organic material. Today, you will realize if you sift through it, 30% is healthcare. You'll see plastics of healthcare. You'll see syringes. This is the problem. So my confession to you is that we are part of the problem. And if we don't accept that, we have no right to tell somebody else, sort this out. We'll sort this out for you. What is the roadmap for the future? This is all a problem that we've identified. We know about, some of us more distinctly than others. How do we sort it out? What is the way forward? Energy efficiency. The recent hospital I've set up in Kanpur, which is 450 beds, we made sure that we are LEED Gold certified. This is a small town. This is not in a fancy part of the world. But we made sure even in these kinds of cities, we'll do LEED. And it is my assurance and a commitment to everyone sitting here and the communities we serve that everywhere we go, sustainability in building our hospitals will be part of our mission. I'm also proud to tell you the fact that waste, I mentioned disposal, but the paper waste we do in hospitals is amazing. A single blood report now comes in 18 pages. It used to come on 1 page before, now it comes in 18 pages because we want to make it fancier. We want to look it nice. We have 5 different things. I'm proud to tell you, in Kashmir, our hospital, we are on electronic medical records. There is no paper. All our doctors are working on electronic medical records. It's a testament to our clinicians and our doctors there who are sitting in a small town. I didn't have to push them. They wanted it. That is part of our commitment. This is part of the solution. The other point is how to manage this plastic waste. Earlier in our careers as doctors, we would have seen, we would sterilize stuff. We would reuse stuff. Catheters can typically be reused. We have plasma sterilizers, we have ETOs. Our health minister is sitting here, ex-health minister, sir. Today, the burden, compliance burden on us is, if we reuse anything, the drug inspector will come and charge you with the crime that you've reused it. Whereas you should be getting awards that you've reused it, because it's a cost reduction and it's environmental friendly. The policies need to support. Without policy introduction, this will not happen. My humble submission to all of us, each one of us, in any sphere of life, is simple. Let's look inside. Let's make decisions that affect us and our communities. Take responsibility and do everything in our powers to make a difference. Paras is committed to make a difference not only to patients' lives, but to the communities we serve. It's our responsibility, it's our community. Thank you, ladies and gentlemen, for giving your time and your patience today.
I would request Kamal to please come on stage and present Dr. Nagar with a memento, some very hard-hitting words coming in from here. I just hope that all of us also make a contribution to sustainability and not wait for incentives and regulations from the government.